I'm a Senior Project Associate at SAMHSA Service Members, Veterans, and Their Families Technical Assistance Center at Policy Research Associates Incorporated. We are funded through the Substance Abuse and Mental Health Services Administration. Next slide. There we go. I wanted to take a moment and talk about our Technical Assistance Center. Our SAMHSA Service Members, Veterans, and Their Families Technical Assistance Center is working throughout the country, and the reason that we wanted to host our session today was to talk to you about the different projects that are happening throughout the country. Our TA Center works with states and territories to strengthen their behavioral health systems that are serving service members, veterans, and their families. It provides support, helps to identify and disseminate best practices to the provision of technical assistance and the promotion of ongoing interagency collaboration, which we'll talk a lot about today on our session. So far to date, our TA Center has worked with 47 states, 4 territories, and the District of Columbia, and they've all established operational interagency teams that have developed strategic plans to accomplish this goal of building and enhancing service systems for our service members, veterans, and their families. We're going to refer to throughout the session as SMVF, and also commit to sustaining and expanding the teams and implementing and enhancing their plans. And some of the work that you're going to hear about today on the call from New Hampshire and from Kansas have been part of our team's work. So we're going to be talking about the work that many states and organizations have done to both ask the question and to identify those who have served. Next. So just a quick webinar format. We're going to have about 40 minutes worth of presentations. I'm going to talk a little bit about our work and give you a little bit of the national picture. And then we're going to transition to Joe Monsher in New Hampshire. And then after that, we're going to hear from Aaron Estabrook in Kansas. That's going to leave us with about 15 to 20 minutes of question and answer time. What we'd like you to do is post your questions in the panel on the side of the screen, and at the end of that session, we're going to try to get to as many of those questions as we can. The other piece that's important for you to know is that we are recording the session, and there will be an archive that will be sent to all registrants next week that will include the slides as well as the audio. Okay, next slide. So before we get into the presentations of Ms. Monsher and Mr. Estabrook, I want to just give you a little bit of background about why this is an important best practice to disseminate and adopt. We've been talking about this conversation with our states for a long time about recognizing who our veterans are in of service members and who are also who that we may also have service members in our service system who may not necessarily who may need services through other access points. So there are a variety of drivers. Enterprises of all kinds have embarked on different types of Ask the Question initiatives over the past years, and we're going to talk about know how to ask the question. Why are we asking the question, and what do you do with the information and the person afterwards? And that's an important part of recognizing who's in front of you and who's in your service system, then also being able to refer them to the services that they need. Next, please. Across systems, agencies, and communities, veterans may be at a higher risk. We're hearing a lot about that. There are suicide prevention concerns that we have, as well as PTSD, TBI, et cetera. Also, service members, veterans, and their families may be eligible and entitled to special benefits and services. So if we don't recognize them within our service system, we may be missing opportunities to connect them to those services. And then also, what we're working with a lot of our states on, and our states have been doing this for a while, is gathering data so that they have a better understanding of who is in their service system, and then can address their gaps and areas of need by having the data to present on that. And then finally, there's a strategic planning relationship that exists. If you know the population, you know the gaps. And then also you can recognize what is needed to meet the capacity. And also also, there are more groups in the community, the more groups that in the community that implement the same standards, access is going to be improved. So that's another piece that we'll be touching on today as well. Okay. So, approach to identifying service members and veterans and their families in the community. As many of you may be aware, there are an awful lot of approaches to asking these questions. In the early days of having this conversation, some people were saying, "Are you a veteran?" But not every service member or veteran identifies as a veteran. I had spoken to a woman early on whose young son had recently left the military. He was in his early 20s. He didn't see himself as a veteran. So it's important to consider that when you're framing the questions. And what a lot of our states and a lot of organizations have done have changed up the question. And there are different approaches, such as, have you or a family member ever served in the military? Have you or has a loved one, someone you loved, served in the military? Or also even, have you or someone close to you served in the military? And who we ask matters. There are many different people who may be close to the veteran. It could be a parent. It could also be, obviously, a spouse. So those questions can reflect different pieces and can help inform the process. And another piece that we're looking at is working with school districts to identify children of active duty and veteran families. And Mr. Estabrook will talk about that. As I mentioned, parents of service members, veterans, and their families, they tend to be in caregiving roles in some instances, and parents need to be able to, they may need some services. There are caregiver services that are available, and they may also be able to connect the veteran or the service member to services if we are recognizing that they could be a conduit of information. Quickly, to touch a little bit on the national picture, all states and territories, to some degree, have participated in initiatives to identify service members, veterans, and their families in their communities. This has been going on for quite a while. The pieces that we're going to touch on is the have you ever served in the military. I'm going to expand on that a little bit more in the next slide. And the states that have done that at the national level are Alabama, California, Connecticut, Florida, Illinois, New Jersey, Ohio, Texas, Virginia, and Washington. Also, the states of Arizona, Kansas, and North Carolina have also undertaken initiatives to identify service members, veterans, and their families in their communities. Next slide. And then, before I get into the American Academy of Nursing, the Have You Ever Served initiative that they've done, I did want to just note that it's important to note that the term asking the question can mean several things in behavioral health. We've been hearing that suicide prevention. If we term it in ask the question umbrella, someone may be asking a question as it relates to suicide prevention. There could also be, there's also an Ask the Question campaign in the LGBTQ community. So we're looking at it now more in the have you served or have you or a loved one served category. So that's just something to bear in mind. So one of the examples that we wanted to provide in this webinar is some information on an initiative that has an awful lot of sponsors and a lot of entities involved. The American Academy of Nursing got involved in a Have You Ever Served in the Military initiative, and they've worked very closely with the state directors of Veterans Affairs, and they have toolkits and resources for health professionals. Those, I have a link at the end of our slides to the so you may that helpful. And as it's noted here, it's been endorsed by the National Association of State Directors of Veterans Affairs. Next slide. Some of the other organizations that have resources are the U.S. Department of Veterans Affairs, the Community Provider Toolkit. Again, there's a link that you'll have at the end of this slide. And then also, it's worth noting that the American Medical Association in 2015 asked healthcare providers to ask patients if they've served in the military and then make sure that that's in their records. There have been other efforts as well, joining forces, Military OneSource, the National Center for PTSD, and veterans organizations such as Heroes for Hire that have all looked at this issue to look at how we're asking the question and how we're collecting that information. Next slide, please. The piece that I want to just touch on, and you're going to hear from Ms. Musher in her work in New Hampshire, the interagency collaboration is really critical. We alluded to that a little bit earlier in one of the other slides. Agencies are asking the question in a consistent fashion that is going to be more accurate, and you're going to get a more accurate picture. And also the interagency collaboration is critical because you're going to be able to refer the veteran, the family member, service member to the resources that they need. So that collaboration component is really, really important as you move forward with this process, building relationships, building those networks, and making sure that collaboration is in place. And if there's need to enhance that collaboration and build additional collaboration. Okay, and I've gotten into this a little bit. SMVF will interact with the service system in a variety of ways, and I think many of us realize this. Healthcare providers, schools, colleges, universities, from an employment standpoint, whether it's jobs or helping people change jobs, there's a variety of ways that this population can interact. The justice system as well. And housing. When you think about housing, it could be someone looking for a mortgage or a loan, and then from other housing perspective, the interim and permanent housing. So there are many, many, many resources available for this population. So when we're asking that question, at all of these different service systems, which doesn't encompass every single service system, certainly, but is just a smattering of some of them. If those service systems have a better understanding of whether they're dealing with a veteran or a service member or their family member, then they're going to be better able to get them to the services they need, and hopefully, as the system is built, those services will be accessible to So asking the question in a consistent way, the system can better help veterans to access the services they need. Okay, so now we're going to transition to Joe Monsher, who is the Bureau Chief at the Bureau of Community-Based Military Programs at the New Hampshire Department of Health and Human Services. Our Technical Assistance Center has worked for several years with Ms. Monsher, who has done an awful lot of work on a variety of initiatives and has helped to coordinate this very exciting initiative that's been rolled out in New Hampshire. She serves as the Bureau Chief. She is responsible for developing military-civilian partnerships to improve education, outreach, and services. She represents the department in working with the VA medical centers, the New Hampshire National Guard, and the vet centers, as well as other military and civilian provider agencies in New Hampshire. She's held numerous leadership positions on New Hampshire's Legislative Suicide Prevention Council and was responsible for oversight of the state's Deployment Cycle Support Care Coordination Program. She also serves as chair of the Legislative Commission on Post-Traumatic Stress Disorder and Traumatic Brain Injury. And under her leadership are the Policy Academy team, which is the team that's been working with our Technical Assistance Center, is spearheading a number of military culture strategies that foster collaboration and interagency partnerships to increase access to services for SMVF. Joe, I'm going to turn it over to you.
Super. Thanks, Joe. Everyone, and thank you so much for the opportunity to participate in this webinar, and thanks so much to SAMHSA for the amazing partnership and support you've provided to our state for so many years. Next slide, please. New Hampshire launched the Ask the Question campaign about 11 months ago for a couple of reasons. In addition to what Michelle shared, we had our own lessons learned, if you will, and one thing that happened is the New Hampshire National Guard nurse came forward, and she was working in an emergency room of one of our hospitals. Legislative Commission on PTSD and TBI conducted a survey, and we surveyed and we received survey information from 1,200 New Hampshire veterans regarding their barriers in accessing care. It was a simple survey of 12 questions. 1,200 veterans in New Hampshire told us that the #1 barrier in accessing care was stigma, embarrassment, and shame. The second highest barrier in accessing care was, I do not feel understood by the providers who serve me. So that, those things that were happening in our state moved us in a direction to look at the Ask the Question and to really implement something in our state. Ask the Question for us has provided an opportunity to engage civilian providers, to educate civilian providers, and to identify veterans, service members, and their families who present at provider groups. The slide you see in front of you is one of our favorite slides regarding Ask the Question, because when we highlight this poster in front of groups, one of our questions is, who's the veteran in this picture? It always starts a dialogue of, we're not sure, because we don't ask the question, and everybody feels very differently about who the veteran might be in this picture. I also want to point out the website on the bottom of this slide. This is a website that is packed with information. Next slide, please. So for us, what is the question? States are identifying this question in a lot of different ways. For New Hampshire, our question is, have you or a family member ever served in the military? I'm a veteran. I identified as a veteran until I took this job 7 years ago. How can I identify as a veteran when my brother is a combat Marine who struggles every day? I went in for a free education. I moved on. We also know that you can serve in the National Guard for 20 years and never be identified as a veteran. Oftentimes, female veterans might not identify. So there sure is a lot of reasons to be more proactive in identifying our military. We sure like the SAMHSA question for the title of this webinar, which is, have you or a loved one ever served in the military? Love that. It's another opportunity to be more inclusive as we identify this population. Next slide, please. For us, when we looked at Ask the Question, we created a vision statement. Our vision statement is all about inspiring, empowering, and encouraging. At the legislative level, we have several discussions around, do we want to create legislation, try to establish legislation to mandate this question on certain forms across our state within certain sectors? We decided against it. We'll visit this at a later time, but felt pretty strongly that, here in New Hampshire, every one of our commercial license plates says live free, die, and we're the highest veteran population per capita in the country. And folks just felt that, look at the population and what New Hampshire looks like, we wanted to encourage, inspire, and empower, and really educate civilian providers as to why they should be identifying military. Next slide, please. The question, this is just a slide from our website, and if you see at the bottom of that slide, you're going to see some of our sectors. So the New Hampshire Ask the Question campaign looks at 12 different sectors. And in addition to the sectors you see on the bottom of this slide, we have other sectors like education, housing and homelessness, legal, mental health, substance use disorder, women's issues, and social services. Next slide, please. On our website, there's tons of resources. We have a provider toolkit where folks can download all kinds of materials. We've got vignettes on each of our 12 sectors. So you're looking at a sector vignette on law enforcement. We have a vignette on each one of our sectors. We have screening tools. On the front page of our website, you're going to see a video, and it's a 5-minute video that highlights 6 different providers and why they feel it's important to ask the question and how they're helping veterans, service members, and their families secure care as a result of asking the question. One of the highlighted pieces on the video is actually a judge. He's judge of our first veterans track in the state. New Hampshire has 3 veteran tracks, dockets right now, but the first one is Nashua and New Hampshire community, and a judge speaks to the importance of asking the question within the justice-involved veterans arena as well. You're also going to find all kinds of VA resources, VA FAQs, and information on this website. Next slide, please. So really simply put, when service providers ask, they can do a number of things. Number one is really understanding the relationship between military experiences and medical symptoms. Connect to the VA. This has been an important message that we have needed to share with our veteran service organizations and our veterans. This is not something we're doing in competition with the VA. We are doing this in partnership with the VA, and it's a very strong and positive partnership. We really have what we call impact statements, an impact document. It highlights numerous stories of success, where it's a welfare staff worker asking the question and hooking up a homeless veteran into homeless services. We have a story of a house that burned down, and the response team saw the vehicle that had a license plate that said veteran. So they asked the question, by asking the question, they identified a veteran. They were able to hook up that veteran to a vet-to-vet peer representative who drove that veteran to the VA to pick up his prescriptions that were lost in the fire. We have schools that are asking the question, just all kinds of examples, and we continually to rotate those stories and share those stories with all sectors so they can see the benefit of asking the question. Next slide, please. The VA partnership with Ask the Question has been critical, and we started that partnership day one. So we have partnered with the VA on the development of the Ask the Question campaign when we were creating the idea behind it. VA leadership serves on a lot of our committees that are a big part of Ask the Question. We also had a mental health director from one of our VAs serve on the DHHS contract evaluation team. So for us, Ask the Question is a contract managed by Easter Seals New Hampshire under a DHHS contract. And when HHS reviewed these contracts, we included the VA as well as other military representatives. And it was the first time in the history of our state and the first time in the history of our department that we created a DHHS contract evaluation team that was a beautiful blend of military and civilian leadership. The Ask the Question website was launched. Right away, we learned that we were starting to get questions from folks, and they were asking us questions about the VA. You know, there's a website that talked about the VA that included VA information. So immediately we reached out to both public affairs offices, both public relations offices at our VAs and said, how can we make sure that this is one consistent message? We are answering these questions that the VA was comfortable with, and that to make sure that we were all on the same page. Next slide, please. One of an HHS contract that we initiated was military culture trainings. What we learned immediately is that the Ask the Question campaign and the military culture trainings that were taking place across the state they married together. I do not think we would have had the success with Ask the Question if we did not have a strong military culture training initiative. This training for us was managed by an organization called Dare Mighty Things that does trainings across the state on military culture training. What we learned also real quick is many civilian providers were nervous. It's like, okay, we support the idea of asking the question. We support the idea of changing our forms, but, you know, holy smokes, what if somebody says yes? Then what do we do? How do we identify and connect that veteran or their family member with resources? So it's a huge piece, and when we done an evaluation of a lot of these military culture trainings that have taken place across the state, the biggest value of these trainings is the identification of resources. Where those resources come from the person in the room standing next to you, or where it comes from a resource guide that's passed out, or from the facilitator or presenter who's sharing information. The military culture training and the Ask the Question and the resources are critical. Resources are really what connects Ask the Question and the military culture training work that we're doing. Next, please. So, in the 11 months since this campaign in New Hampshire has been launched, we've received some significant national attention. And when I look at that, it makes me question, well, what makes New Hampshire maybe different, or why have we gotten this kind of attention? When we look at our campaign focuses on, we can break out into a couple different components. One is media and marketing. We've got all kinds of media out there, rack cards, bracelets, billboards, Facebook, a very active website, a lot of different media, and that's been critical to building awareness of this campaign. We also have an outreach team that went out into the communities and tackled different sectors in introducing Ask the Question. And we also have an amazing data collection and analysis as part of this campaign. But when all is said and done, I think what's really getting the attention of the community, not just here in New Hampshire, but across the country, is, if you look at the bottom sentence on this, our former commissioner, who was a huge supporter of this, shared a message, because he was a strong advocate for this. And he said it's a deceptively simple question and concept, so incredibly powerful, because it just opens up the conversation. And when we across the country recognize that stigma is one of the #1 barriers in accessing care, Ask the Question addresses that by creating conversation, by education. And conversation is a pretty powerful way to tackle stigma. Next slide, please. Just a quick data snapshot. We're in the middle of collecting a lot of data right now. This contract, the funding for the contract actually concludes at the end of this month. Our campaign is sure not ending, because we have built up such an incredible amount of collaborative momentum that we have many, many different groups in the general community that will be moving this forward in a lot of different ways. The Hampshire Legislative Commission on PTSD and TBI has also made a commitment to move this campaign forward in every way that they can, through outreach and presentations and all kinds of things. We're currently looking for funding to set us up for the next year two, so we can focus on different things. If you look at the snapshot of data in front of you, you'll see the 12 sectors that we focused on. Sectors were more successful than others for a variety of reasons. One is it's the Ask the Question outreach team had a strong background. They came from the ServiceLink Aging and Disability Resource Center. So they automatically have connections in the social services arena. New Hampshire is very involved in serving justice-involved veterans, and that has received a lot of attention. So it makes sense that our law enforcement strong participant. You'll see that that higher education is a weakness for us. So we look forward to our next presenter to learn more about how New Hampshire can tackle that. So the bottom of this sheet, you see that we've reached over 2,000 providers. So those are providers that we've had a sit-down conversation, several phone calls with. That number does not include the number of folks we've reached, the veteran service organizations, the veterans, the general community. That's been significant. You'll see that our impressions, we've hit over 7 million impressions, which is also pretty significant. Next slide, please. Our data snapshot shows where we started with. And again, we're just completing a lot of this data, but the piece I do want to bring up is out of 850 assessments done on 850 providers, when we started the campaign on July 15th, 8% of them were identifying veterans in the correct way. Today we're at 72%. But to be real clear, that 72% represents 72% who plan on doing it, who believe they're going to do it. So when all is said and done, we'll see where we get to. But either way, it's a very strong number. It's a good number. Next slide, please. for us, Ask the Question has, we've got numerous military access initiatives taking place across the state. Ask the Question has been at the absolute core and center of everything we're doing. It's turned into all kinds of amazing things that I sure don't have time for on this call. It's brought hope to military families because it lets them know that New Hampshire cares. It's opening up conversations that's leading to all kinds of impact and outreach and collaborative partnerships between military and civilian groups. And finally, it's creating pressure points that will lead to culture change. For example, our civilian providers, as they learn more, they want to serve this population. That question provides a way to do that. Also, our veterans, it's providing an opportunity for veterans to learn that we're a state that absolutely cares about this population. And I think it's allowing veterans to maybe raise their hand a little bit more and come forward a little bit more and see how they can work with us to engage civilian providers. So we'll see what the future looks for we'll see what the future looks like for New Hampshire, but we sure look forward to learning from all the states across the country as we tackle this issue and do a better job serving and supporting our veterans, service members, and their families. Thank you.
Joe, thank you so much. I appreciate that. Was a very enlightening presentation. I want to just touch on some of the really critical pieces that resonated as you were talking to me, is that connection to the VA. What many people may not realize is that veterans have access to other services that may be outside of the VA. So not all of our veterans are accessing the VA for their services, but when they do have the opportunity to do that, it's great if there can be a connection. So it's important, one, for our services who are outside of the VA and encountering the veterans to know who's in front of them, and two, to recognize that we can connect them to the VA if there's an opportunity for services. So I appreciate you pointing that out. And then also, I had mentioned before we started this that the importance of military culture training, and we do need to recognize that as we are identifying our service members, veterans, and their families, there needs to be an awareness of military culture. So that's an important piece to keep in mind as we continue to move forward in this discussion. So our next presentation is next slide, please. We're here from a board member in the Kansas Board of Education, Erin Estabrook. And Erin is going to talk to us about what they did to identify the children of service members and veterans in their communities. And we've heard a lot about recognizing who's in our population. And what we've seen at the national level is that a lot of our states are interested in recognizing what in schools are in military families or veteran families, because it can impact their work classroom, it can impact their lives as well. So what Kansas was able to do is develop relationships, and Erin's going to walk us through that process as we go into this next part of the presentation. So let me just take a second to introduce Erin. Erin Estabrook is a board member of the Manhattan, Kansas Board of Education. He currently serves on the Governor's Behavioral Health Services Plan Council Subcommittee for Veterans. And he's been involved in policy issues both at the state and federal level. He is also a veteran who served, and when I spoke, he talked a lot about, as he came back, he recognized the importance, especially with children of his own, of recognizing this population. So, Erin, I'm going to turn this over to you. Welcome. Go ahead.
All right. So, next slide, please. We talk about is called the Military Student Identifier, and how this process has evolved over the last 8 months, really, to kind of get Kansas maybe on a leading edge in some respects of asking the question. Next slide, please. Back in November, I was asked to present to this subcommittee on behavioral health that the governor runs, and I am now part of that committee, but I came to address them on Veterans Day and kind of presented some of my transitioning as mentioned, I'm a former combat veteran. I was in Afghanistan in 2010. I transitioned out of service in 2011, and civilian working with homeless veterans in 12 and 13, 14. Kansas. So I'd kind of gathered a lot of different perspectives and served on NAMI. Maybe some of you are familiar with NAMI, and the national vice chair for NAMI, and kind of gives calls. November 2015 time, I had been hearing more and more on each of those calls from different representatives around the country. There was a lot of interest in what was happening to not just the military member or the veteran, but actually their dependents, and not really just the spouse. Really, their kids were becoming more of a focus. And here, where I'm located in Kansas, is right next to Fort Riley, and some of that was kind of also happening around in our community, where some kids and students in particular were exhibiting some of these same things that were happening, across the country. So I asked the committee to keep that in mind. What we've done a lot of informational things about talking to veterans, talking to active duty, and talking to married spouses, but I don't know that we have really been able to focus in on the kids. And so I posed that question to them, and they immediately shot back to me as a board member. How do you count military dependents in schools? And I think that was the question that really got everything up in, because I knew locally, but I wasn't really sure why or how. And so, slide please. During this phase, I started doing some of my research, and I also had started to reach out to our Commissioner of Education, and I asked him question, do we do this count, and why, and is it mandatory if we do it? And he said, no, actually your local district does, but that is, voluntary basis based on some property taxes associated with the bases that are located by. Nobody is needed to do this, and that sparked another question. What about the reserve, and what about the National Guard? Me and serendipitously consciously doing something, and that it was really kind of cool that we had a discussion going on that was kind of on its own here in Kansas, and seeing what was happening at a federal level. This Every Student Succeeds Act passed, and I began to kind of see some releases from the Department of Defense and militarychild.org and others celebrating this achievement of what was being called the Military Student Identifier. So at that point, we kind of had a name for it. We didn't know what we were talking about until that point, and we realized that what was done at the federal level was also really kind of we were trying to get to here at a local and state level. Just to refresher, this slide kind of outlines what the ESA is. It replaced No Child Left Behind, but it requires that every school district in the United States report or capture a count of the active duty military dependent. As our group kind of progressed, and I'll describe that group in just a second, we wanted to include the reserves and the National Guard, and I really kind of wanted to also include the veterans who had recently separated, having my background working with homeless veterans and some of those concerns that I was close to. But this was a good start, and it became federal law. The President signed it December 11th, 2015. And next slide, please. So the process kind of, as I mentioned, was identifying that decision maker who we need the Commissioner of Education for the state of Kansas for our kind of jurisdiction. The legislative route, we thought about it, and we wanted to try to see if we could make this kind of a little bit smoother by internal State Department of Education format. And so that's where we went to the Commissioner of Education, asked him some questions, and began to set up some meetings. In the meantime, we built a team around some of the stakeholders that I, hoped would be part of this, and asked if they could identify somebody else. And so we had political stakeholders, and I looked for veterans in every one of these capacities, educational, social bureau, and our Community Mental Health Center Association, along with the National Guard and the Reserves chair for the state. All kind of signed in. We built our research around just the pediatric journals, and just kind of combined a lot of different data out there, and built and set up the meeting with the commission. Next slide, please. He met with us, and he was receptive. He was definitely receptive to the active part, because it was going to happen anyway. And that was kind of the hammer we brought to this, was ESS passed. This was a federal law, and so she's going to happen. And why are we doing it? Why don't we do the right thing and include reserves and National Guard instead of trying to go back and fix that problem? When we made that case and he was open to it, it was a harder case to make, to include recently separated, that was not as well met, I guess, without a little bit more research. He agreed to take that information to a tenant meeting, which included representatives or superintendents from the 286 school districts across the state, and they asked questions of him when he said, "We're thinking about doing this. What do you think? What are some problems?" And most of it was about process or why we need this. And I found it a little bit funny that they thought that the military should know where these students are, and we then designed a white paper that addressed their questions. And in time, it was kind of met with, "Why should we do this?" First, we would say, well, the Every Student Succeeds Act passed, and it's federal law, and it's going to happen. But it's also good. We need to provide the social-emotional tools, the data to strategically plan and get the resources where they need to go. But don't forget, this is law. We're going to do it. Next slide, please. And we have success. Just in May, the Department of Education officially adopted our position, our kind of committee that we put together, and they are agreeing to capture students, not just the active duty that's required by federal law, but they are including the Reserve and the National Guard and the mission of all families across Kansas. We know at least 11 to 12,000 families live, and they're spread out across the 400, 200-mile state. We just don't know where, and we know at least 54% of those about have kids in school. So next slide, please. This is the questionnaire that's going out, and that's literally the question is going to be asked upon all 286 school districts, and the superintendent will then provide that data to the state. It doesn't include the personal identification markers, but it does give us an idea where the populations are, where we need to kind of allocate resources to make sure the needs are met. And that I have.
Thank you very much. I wanted to take a quick second. I'm going to do a little bit of tie-in between our different presenters, but I did want to remind people we've had a couple of questions. We will, in this last portion of the session, field questions. So if there's a question that you want to pose to Joe or Karen, please post it in the question and answer panel, and we will do our best to get those. A couple of questions that came in relate to funding and resources, and things that we've seen nationally, and I want to have Joe speak about this as well, but definitely resources are stretched, and that's acknowledged in all of our work with our states throughout the country. But one of the things that does emerge as the conversation happens is that there are ways to leverage resources, and when there is the collaboration, the interagency collaboration that we've been talking so much about on this call, there are opportunities to leverage those pieces and braid funding and look for opportunities for other funding. So that's something that can happen as more of the conversations are happening. So I just wanted to talk a little bit about that, because I know there was a couple of questions about how to get some more funding for this population. And certainly it's important to keep asking those questions, collecting data as well. As we talk a lot about this, Kansas will now be able to point to where these children are located in their schools, and so that's information that they'll be able to use when they need to advocate for other resources. And then, too, I know in New Hampshire there'll be more data to help identify the gaps in the pieces so that there's a way to. But, Joe, let me move to you. I'd love to hear from you. You've been really successful in building an awful lot of relationships in New Hampshire. Do you want to talk specifically about the way you've been able to build the resources and the capacity in New Hampshire for a few minutes?
Sure. I think one of the things I would speak to are the military and civilian groups across the state. So New Hampshire has a number of military and civilian commissions or committees or coalitions, and we try to, around everything we do, we try to align those committees. For example, we currently have a governor's commission on alcohol and drug abuse prevention and treatment. It's a very powerful governor's commission on substance use disorders. We're trying to get more attention to that group regarding veterans issues. We weren't able to add more members, but we continue to look at it, and we learned that we were able to add a task force, one of the subcommittees focus on military. So instead of, when we look at our structure across the state, instead of trying to say we've got a civilian group working on this issue, let's add a military group, we're trying to weave our military groups into everything we do. Another example of that is the Ask the Question campaign. We didn't just HHS to provide oversight to that. So we aligned it with the New Hampshire Legislative Commission on PTSD and TBI. And that Legislative Commission provides oversight and serves as, not oversight, I'm sorry, but provides as an advisor to that work. Another initiative we have is the Community Mental Health Center Military Liaison Initiative, where we embedded a military liaison within each of our community mental health centers. One of the big outcomes of that initiative has been to engage all of our community mental health centers across the state to ask the question. And what that led to is a year ago, only 2 of our community mental health centers were enrolled as TRICARE providers. Today we're at 8, and by the end of this year we will hit 100% of our 10 community mental health centers will be TRICARE providers. So it's an example, I guess, of how we're how we're aligning Ask the Question with a lot of different initiatives, because we really see it as the core of what we're doing.
The next question, it goes to Erin. And the questioner was asking, mentioned the military family life counselors in schools. So, Erin, what she was wondering is that something that has been or is being done in Kansas already? Are you aware of some of what's being done with the counseling staff in schools, Erin?
It has been done to a degree with some of the districts that have been close. So we have Fort Riley that has, about 30,000 soldiers, and we have McConnell Air Force Base, and we have Fort Leavenworth here. And so the districts that are directly rubbed up against those bases kind of have been doing voluntarily because it was necessary. There wasn't really any kind of funding. It was the problem here is the data also leads to strategic planning, and then we can have better partnerships with some of these funding questions. Yes, and one of our core members of our team that we went to the education commissioner was a school counselor who was somebody that worked and kind of ran some ambassador programs for military kids to have lunch together during school and meet and discuss deployments and those things. And we want to take that beyond just the students that are located near bases, because so many are in National Guard and Reserve. 10% of our population here have some kind of veteran status. We have a lot of families connected to the military across the state, and just not getting the same type of resources because they're not rubbed up right next to a base.
Thanks. There's another question about Kansas, too. Did the Kansas white paper include the need to count veteran children? And then is there data collection that's counting veteran children, is what the person asked.
There's not the count. And, the white paper did, and I tried to make a passion case for that, as it works with homes and veterans at risk of becoming homeless across the state. Families this is where I really saw the problem arising and needing to be able to have resources and know where to go, because I was just kind of pointed to go find people rather than having any kind of data direct me. I was not successful in making a case, but I will still continue to make the case that I think that that count is important, and the research is there. It's a matter of this step and a bigger step than they had to take, and we're going to continue to try to make them take another step later. I think it should be included in everybody's ask if they do that.
Okay, very much, Aaron. I appreciate it. We had another question, too, about research on approaches that work best about addressing stigma and accessing mental health and substance abuse services for service members, veterans, and their families. And what I'll do is we will, in our follow-up email that will go out to everyone who registered for the webinar, we'll include a link to some of those resources so that you'll have that. SAMHSA's website does have an awful lot of resources that you'll be able to access as well, but we'll include some other links. So I think we've covered all of the questions. I just want to check in with Joe and then with Aaron. Joe, did you have any final thoughts or any other comments you wanted to make as we wrap up?
I don't think so. Just that this has been an amazing way to engage civilian providers and create conversations. I guess I would share one story around education. First, I just want to applaud Aaron and Kansas City. I think what you guys are doing is just amazing. One education story from New Hampshire was the University of New Hampshire started to identify veterans through a special orientation program. And one of the veterans said that when he was sitting in a classroom of 300 people, normally he would have panic attacks and he would be unable to sit through that classroom because of his post-traumatic stress. Now, because the university had identified veterans through an orientation program, he can look 4 rows back or 12 rows over and he'll recognize a face, and he might not know that veteran, but he knows that person is a veteran, and he feels that that veteran has his back, and he's able to sit through that classroom, and it reduces his panic attacks. So that was a huge eye-opener for us in terms of creative ways that some of the universities are tackling this issue.
Thanks, Joe. And the personal story interactions are always really important because they make it more real. So thank you for sharing that. Aaron, let me turn it to you now. Are there any other final comments or thoughts you'd like to wrap up with?
I think I just want to remind everybody, if one thing is even us so tightly close to Fort Riley and the veteran community that we have here in the active duty military community we have, People thought that we knew more than we did, and our teachers knew more about their students than they did. Many people weren't asking the right questions. So if we're not even doing it, I think we now, and we're trying to get that cleared, that the fine for the students of military families is really the classroom teacher, or often the pediatrician, and I think those questions that are asked will help get those two key people really some assets that they need to help address the social and behavioral problems that come along with being in a family in the longest war in modern history.
Aaron, and I think both of you have illustrated the importance of building the relationships and really what can be done as those relationships are built. So we appreciate that. And you're right, now that you're asking the question, there's even more information to be mined. So that's wonderful. All right, just as we're wrapping up, I want to thank both Joe and Aaron and for all the work they put in to put this together and to share it with us today. I want to note that on July 12th, there will be a webinar coming up on caregivers that our Technical Assistance Center will be offering. The information about that webinar will also be in our follow-up email, include the archive and the slides for today's session as well. And then finally, on the current slide, and this will be in the archive, is our contact information. If you have any questions, we'd be happy to answer those questions. So thank you all very much for taking part today, and we hope that we will be continuing to move forward and making a lot of progress by where our veterans in the communities, our service members, veterans, and their families. Thank you all. Have a good weekend.